Okay. I think we're getting there, everybody. Let me look on my phone and make sure that yep, we are on live. So I'm a couple minutes early. I always like to be ahead of time in case this doesn't work well. So for anybody who's joining, welcome. A little introduction on myself. My name's Lindsay Venn. I am a physician assistant, a registered dietitian, as well as a metabolic health practitioner. I work for my own company, which is Venn Integrative Medicine, as well as for Insulin IQ. And so my purpose and my plan is to get as much information out there as possible. There's so much nuance to all the different things that come down to diet and fasting and hormones, you name it. And for tonight, I really wanted to touch on GLP-1. And so the whole presentation is specific for GLP-1 tonight. What is it? What do we do with that information? How can you get it? How can you increase it naturally? Do you want to take one of these medications, and why you may want to or why you may not want to? I'm also going to be including some clips from Ben Bickman on his thoughts when it comes to GLP-1, as he is a world expert on the subject. And so you're going to have to bear with me when it comes to his clips. I'm going to have to be switching back and forth between screens, but hopefully it goes off smooth enough that everything goes okay. So let me get my PowerPoint and then we will go from there. I'll share my screen. Give me just a second. Perfect. So hopefully you all can see this okay. It looks like it's coming on. There it is online. So perfect. So GLP-1, we're going to talk about what it is and the science behind it and why it works and why it's important. But GLP-1a stands for agonist. And so it is an agonist is a medication that mimics the effect of GLP-1, but we're going to do a deep dive into what it is, and do you want to consider an agonist? And if you do, who should, who shouldn't, how should you do it? All of those kinds of things we're going to talk about in detail. So first of all, what is it? GLP-1 stands for glucagon-like peptide number 1. So it's an incretin hormone that's produced in our intestinal tract, specifically by the L cells of the intestinal tract. And there are receptors throughout the body that like GLP-1 and utilize GLP-1 to enhance what they do. And so this includes things like the pancreas, the brain, the heart, the kidneys, the thymus, the lymph nodes, the immune system, etc. And I did put in here a citation exactly on this that was done in 2019, really talking about what it is and the numerous metabolic benefits to actually having optimal levels of GLP-1, however you decide to get there. So first of all, what is this thing and how does it get formed and all of these things? Like I said, it is made in the L cell of the intestinal tract. GLP-1 is secreted from there and it then enters into the bloodstream. And that's what this picture over here indicates, is it's in our bloodstream, and then it goes into various different kinds of receptor sites to be utilized. So very complex, but just letting you know a little science behind it. So what are the metabolic benefits to it? So when it comes to things like your weight and diabetes, it really does impact, again, both natural or taking an agonist medication. It does slow down gastric emptying. This is a good and a bad thing, depending on how high we're driving the dose up on different things. But when we slow down gastric emptying, it helps us feel full longer and it helps us feel full faster. And so we tend to eat a little bit less because of that. It does increase natriuresis and diuresis, which means urinary excretion of both fluid and electrolytes. And it does modulate beta cell proliferation. And so this was seen primarily, and a lot of people say that, oh, if it increases insulin production, that's a bad thing. That'll drive up my insulin resistance a little bit further. But that was only seen in the lab in what we call in vitro studies, which means in a petri dish. It was not actually seen in humans in the natural body, and we'll talk a little bit more about that. There is a cardio and neuroprotective effect as well. So it's going to decrease inflammation. And I have seen this anecdotally in patients who are taking like a microdose GLP-1. They do notice improvement in things like pain and inflammation, and it will decrease the amount of apoptosis, which is programmed cell death. And so there is that benefit to it as well. So there are several implications that will help with things like learning and memory, our reward behavior, which, our cravings and stuff that get decreased are related to that. So here's just an image to show you all of the different places that GLP-1 impacts. And I'm not going to go over this in detail, but it does highlight the fact that the brain is impacted positively, the liver, the GI tract, the heart, et cetera, et cetera. So it really does impact pretty much every tissue in the body. And that is why it's such an important hormone. There's no bagging on GLP-1 in the presentation tonight. GLP-1 is very, very beneficial in the human body, and it's something that we want to optimize if possible. And so now I'm going to do this whole stop share screen thing and switch the screen I'm sharing so you guys can listen to what Ben has to say about it when it comes to a presentation that he gave not too long ago. And let me make it bigger and hopefully everybody can hear it okay.
About the role of what has now become a very famous hormone. I look quite fondly, I almost reminisce to my old my old PhD classes at a medical school. When I was getting my PhD in bioenergetics, I was studying endocrinology, and that was really the early discussions in the early 2000s, about 20 years ago, was the discovery and discussion of a class of hormones from the gut called the incretins. And the most famous, even at the time, was GLP-1. And oh my goodness, if it has become rock star status, where GLP-1, as I'll get to in just a moment, has really become a beloved hormone because of two of its main effects, which is one, it slows the stomach and the intestines. So when you eat something, some things take a lot longer to clear through the body. Just to put a fine point on that, when you eat something, it will often stay in your stomach for about 4 or 5 hours. When GLP-1 goes up, as we'll get to in just a moment, it can be up to 20 hours. So that's going to make you feel fuller for longer naturally. At the same time, GLP-1 is a hormone that is made in our intestines. It also will tell the brain that we don't need to eat. It will tell us that we are full. In other words, it promotes satiety or reduces hunger. These effects of this natural hormone can be so beneficial that they have been, of course, taken advantage of, or it's been targeted and made into a class of drugs. So there.
Okay, so I'm going to stop that right there and we'll go back to my presentation. Again, bear with me as I'm switching screens a few times today during this presentation. Back to this. So like he said, GLP-1 is extremely important and extremely beneficial hormone and not something that should be poo-pooed because of all of the press that it's getting. So my part of this, his part is the science, my part is the application. And so what do we do with these things in order to help somebody out in real life? And so when I say, how am I going to apply this? It really depends on the person. I will look at the specific things such as the severity of the metabolic burden. If somebody's obesity is so bad that it is safer to be on these medications than it is to be as obese as they are, it's definitely a person I'm going to consider. Do they have a severity or a severe burden of disease? Do they have 5, 6, 7 different chronic diseases? For sure, they might benefit from something like these medications. And then the success or the failure of other treatments is very, very important. This is not the place I would want to start with anybody. We of course want to start with the diet and lifestyle, some intermittent fasting, maybe some supplements. If that's not enough, then we can consider some of the other options that are out there. I always look at the age. If somebody's coming to me and they're 24 years old and want to get started on one of these medications versus if they're 64 years old, it makes a big difference because coming off of these medications is not easy. And there is that, if you're not able to come off of it, do you really want to be on something for decades, if you're a young person? So there is that problem. We always, always, always discuss the risk versus benefit for, there's things like thyroid cancer risk and whatnot. And we're going to go over a bunch of that down the road. I look at the patient's compliance. I am so tired of seeing videos online of people who are going to Taco Bell 3 times a day taking their shot, and because they're still thin, they think that they're healthy. You know, the goal here isn't just to lose weight. The goal here is to be healthy, and compliance with the diet and lifestyle change is very, very important. And then, of course, we always take into consideration what the patient wants, you know, and have they been fully educated? It's this thing called informed consent. You know, have they been fully informed, and give consent plays a big role. So what are our options when it comes to helping GLP-1 in the body? So number one thing, and I always stress this the most, diet. You can increase GLP-1 production just by changing your food. So going low carb, increasing healthy fats, doing some intermittent fasting, and adding fiber to the diet can be very helpful, because again, this is produced in the gut. And if our microbiome is not healthy, adding more fiber, both prebiotic and probiotic foods, can really help with boosting GLP-1. There are some supplements that we're going to talk about in more detail too. Allulose is a natural non-caloric sweetener that's really good at boosting GLP-1. And then of course the Feel Great system is something else that Ben has specifically studied that we'll get to in some more of his clips. So the other medications that are there that we're going to go over in more detail as well, those ones I have listed: exenatide, liraglutide, semaglutide, tirzepatide. And then another medication that a lot of people aren't aware of is one like sitagliptin, which Januvia is the brand name for that. That's a DPP-4 inhibitor, which actually inhibits the breakdown of GLP-1, which therefore would naturally increase the levels of GLP-1 you have in the system. And there is the option to do a combination of a few of these things. I have lots of patients who do more than one of these and do fairly well. So again, pardon me while I switch my screen real quick and back to listening to Ben, which I think everybody appreciates. Though let me adjust the video timing so that's accurate when we get back to the video. Oops, that one's not it. Where did it go? Sorry, give me 2 seconds as I get back in here. I need to go to 1938. Perfect. And
Our diet
oops,
to increase our own.
So here we go. Let me just back that up a tiny bit. Oops, not quite that much. There we go. Here we go. And hit play.
Like the things I have listed here. In fact, just recently, a study was published a few months ago that gave people two different meals that were the exact same number of calories, but one had lower levels of fat and higher levels of carbohydrate, and the other meal had lower levels of carbohydrate and higher levels of fat. And what they found was interesting, that the lower carb, higher fat, same degree of protein meal increased GLP-1 by about 3 times more than the other. So if we want more GLP-1, and I would understand why we would, it's certainly a favorable hormone, there are things we can do in our diet to change this. But we can even take it further, because there are specifically.
Okay, gonna stop there for a minute because we'll get into that one in just a second. And back to my presentation. Again, thank you for bearing with me through all the screen flipping that I'm doing today. I'm only gonna do it one more time, maybe 2 more times. So here it comes. So when we start talking about the supplements, which was where he was getting to, there are the two that I really very frequently recommend to my patients. Allulose is a simple no-brainer, in my opinion. If you're using a sweetener of any kind, replace it with allulose. The downside to allulose is it's only about 70% as sweet as regular sugar. And so sometimes when you have a recipe that calls for increased sweetness, you'll have to add a little monk fruit or stevia to it to increase that palatable part of it. So it has been shown to reduce visceral fat, again, because of the GLP-1 and insulin resistance benefits. So improving insulin resistance, it will decrease postprandial blood sugar. And that's because glucagon is inhibited by GLP-1. So it's very potent there. And then, of course, this increase in GLP-1. So I just wanted to prove to you guys that this has been studied and proven in studies, not just in practice. And so how does this work? So allulose enters into our GI tract here, and it gets selected and stimulates specifically right through here in these L cells that I had highlighted before. it feeds those L cells, so it will increase that GLP-1 production. So this, again, that was that study that I had cited that had this image. It has been shown definitely to increase allulose, where glucose doesn't, they compare it to glucose here, where glucose doesn't have the same benefit, that works more on the K cell. So now let's talk about the feel great system when it comes to how it can be beneficial. Again, let me share my screen one more time and get back to Ben. I've got, when you enlarge it, it creates this lovely little problem where I can't quite get to where I need to go. So on this one, we are at 2030, so right where we left off. Let me share my screen. Okay, and make it bigger and hit play.
Created products that have been shown to really target GLP-1. And across both of these products, Unimate and Balance, which constitute the Feel Great system, there are a number of molecules. Now, as a basic scientist, which I am, I want to get to the basic level of understanding. And so these are some of the molecules that have, each of them in their own right has been shown, the first four from Unimate, the bottom two from Balance, have been shown to increase GLP-1 production. All of this has been shown in pre-existing articles. Now, here is what Sam, I know what you're thinking. You're thinking, oh, finally, Professor Bickman's getting to the point that Sam teased you with so long ago, it seems. Let's get to the new research that is coming out from the Bickman lab at BYU. So this is the article. My hope is that it is able to get published in the next few weeks. It is in review right now. So in other words, the manuscript has been put together with all of the data and all of the supporting dialogue, and we've submitted it to the journal for peer review. That's the process. It's the long, frustrating process in the life of the academic. All right, now, so what? So first of all, we confirmed that Unimate does increase GLP-1 levels in the blood by 50%. So that is a significant effect. There are very, very few things in nature that are capable of increasing GLP-1 to that degree. That is big. Indeed, that's a bigger jump than the numbers that I just showed you in the low carb versus low fat meals. So a 50% increase is not a very common effect. Now, I noted a moment ago that there are specific molecules within Unimate. So my lab wanted to try to understand which are any of these molecules maybe a little more relevant than any other. Now, they all come together, and they come together for a reason. So what we're doing is kind of a purely academic point, but it is an interesting one, and it's certainly something to talk about. So we wanted to find out, to what degree does Unimate in its native form affect the L cells of the intestine? Now, I haven't mentioned the L cells yet. It is the L cells of the small intestine that create GLP-1. So what we did was grow a cell culture of L cells in a little petri dish. And then we treated these cells with whole Unimate. And we found that over this time course, there was no increase in GLP-1. So the full kind of raw Unimate on the raw intestinal cells didn't have a direct effect. But remember, 2 slides ago, we know that it does, in fact, increase in the body. It just wasn't showing it at the level of the cell. These cells were not making more GLP-1 when they were just treated with Unimate. So we went a little further. We isolated ferulic acid in particular. And then we found with ferulic acid, there was a small effect on the L cells to increase GLP-1. But that's pretty modest. That's just about 10%, nothing like the 50% we saw before. But in looking into this more, we realized that we were overlooking the body's ability to change things. And in this case, what happens when ferulic acid is consumed, that there are particular bacteria in the intestines that will convert ferulic acid into something called dihydroferulic acid. So when we consume this in a living animal and human, being the pinnacle of all of them, we have ferulic acid being converted into another form, dihydroferulic acid. So with this in mind, we treated these same L cells with this more bioactive form that the body creates. And look at the effect. Now, all of a sudden, the dihydroferulic acid was increasing the GLP-1 levels by almost 3 times, an enormous effect. So the dihydroferrulic acid is the really active version that we have here. And it really does suggest that one of the reasons that the body is responding so favorably, at least in the context of GLP-1, and of course much more, but outside the scope of this lecture, is that the body knows what it needs to do, if you will. And in this case, the gut will take action, and it recognizes a molecule in its raw or native form, if you will, and through a few strains of bacteria like Enterococci or the Bacillus strains, will convert the ferulic acid into dihydroferrulic acid. And that likely is a key contributor to the increase, the 50% increase we see in the body, in the living organism, with an increase of GLP-1 of 50%. Now, one final point I want to make is an interesting paper I found, but it requires me to teach you one last principle as you think about GLP-1 or you talk about GLP-1. And again, we ought to talk about it favorably. It is a hormone that we want to work in our favor. So the conversation should be, what can we do to maximize our own GLP-1 level? Within the body, every hormone has a half-life. It's not meant to stick around forever. But because GLP-1 is so beneficial, we want to keep it up as long as we can. Within the body, there is an enzyme called DPP. And DPP will take GLP-1 and split it apart. And so when DPP becomes active, it's reducing our GLP-1. In fact, this is a component, a DPP inhibitor in some other injectable versions of this drug. So some of the injectables that I didn't go on into because it's adding stuff beyond just the GLP-1 agonist will have both the GLP-1 agonist like semaglutide and a DPP inhibitor to try to prolong the life of the GLP-1. Now, what's the relevance here? Once again, ferulic acid sort of steps in as a bit of a hero, where ferulic acid has been shown to inhibit DPP. And by inhibiting DPP, it's turning it down, and now the degradation of GLP-1 is turned down, thereby giving the body higher levels of GLP-1, or at least allowing the GLP-1 to stay higher for longer, which could be why so many people, and indeed evidence supports that Unamate and yerba mate can promote satiety and help with appetite and cravings.
Okay, so I'm gonna exit out of that, stop sharing my screen again, and go back to my slideshow. Bear with me one more minute as this pulls up. All right, so on to the next piece of this. So let's talk about these medications that are out there, because again, this conversation isn't about just doing supplements or just taking the Feel Great system. It's about what other options you have out there. So a lot of what I'm going to tell you is anecdote, just after years of practice and using some of these things. So the exenatide, for example, or Bidurion, as you see up here, has been around for decades. It's been around for a really long time. It's a diabetic medication and it has been used pretty well for diabetes in a lot of places. So the things that I've noted from my own patients using it is there's very seldom negative side effects from it, but there is little to no weight loss with it. And that's why this drug, even though it's been around for a lot longer than your Ozempic and such, is not as popular because the weight loss didn't seem to happen with it. And that is because of the dose, and we'll talk about dosing in a minute. They did show an improvement in blood sugar control, but it was minimal. Currently, it is actually really difficult to get, and it usually takes a prior authorization to get it covered by your insurance, which is a difficult process for us medical providers. I did want to put on here these, and I'm going to breeze through most of these just not to waste your time, but what is the mechanism of action? Yes, it activates glucagon-like peptide 1, and you have to inject this one every week. Things to watch out for: your thyroid cancers are always a problem. You're going to see that in all of these medications, and all of the side effects that they continue to refer to here, gastroparesis, pancreatitis. Be careful if you're going to have surgery because of that delayed gastric emptying, etc. Kidney injuries can be a problem. Again, pancreatitis. Ileus is a severe form and a potentially lethal form of gastroparesis that happens a little lower in the GI tract. And then the common reactions that you see, and I see it all the time in my patients, things like nausea, diarrhea, or constipation, dyspepsia, which is burping or vomiting, can occur. The next one is your liraglutide. Victoza is the more commonly known brand name on this. I very rarely see this used in practice. It just was hot for a while and now it's not. The problem with this one too is it requires daily injections versus weekly injections. And so a lot of patients don't want to do that. Again, the weight loss is minimal compared to the new drugs. And again, there was only just a slight improvement in blood sugars with using this medication. Here, the indications for it are type 2 diabetes and maybe even some cardiovascular risk reduction, which I'm not so sure about, but that's what they're indicated for. Mechanism of action is the same. It's going to mimic GLP-1, and all of those same side effects and risk factors are present. So you got to be careful with GI things, including pancreatitis, kidney function, liver failure, ileus, etc. And so these drugs do not come without their own problems. Ribelsis, or the oral semaglutide, is another one that we have seen quite a bit of, and this one is overall, in my experience, pretty well tolerated. It does seem that you have to ramp up the dosing, and that's how they recommend that you do it, is just to ramp up the dosing just like you do with the injectables, which I don't love to do that. A lot of the patients really like it because it's just a pill that you take. Again, there's minimal weight loss with this one compared to the other, and then there is a little bit of blood sugar control as well. And so again, it works exactly the same way. It's going to boost GLP-1. It does recommend, like I said a second ago, that you ramp up the dose when you take these medications, which tells me that there's a resistance problem there, that you become either tolerant or resistant to the benefit of the medication, and therefore you require a ramping up on the dose, which I don't love. And the same old concerns. So thyroid cancer plus all the GI problems and side effects. For the semaglutide, which is your Ozempic or Wegovy, these ones, again, these are anecdotes. This is my experience with these. The tolerance varies significantly. Some people tolerate it really, really well. They have no negative side effects. Some people take the first dose at the lowest dose and they wish they had never done it because they wanted to die. So it really depends on the person. There is no predictability to how you're going to do if you take one of these medications. Nearly everyone needs to increase the dose. It has that tolerance or resistance effect to it. The benefit for those trying to lose weight, there does seem to be significant weight loss if you find the right dose for you. Glucose control is much better that I've seen in patients. They like the weekly dosing. It isn't well covered by insurance, which is a bummer because they're very, very expensive if you go through the brand name versions. And just so people know, there is a compounding version out there that is a little less expensive. Again, all the same things that we've got going on here. It's indicated in type 2 diabetes and potential cardiovascular risk prevention. It is a mimetic of GLP-1 again, like the others were. And again, all the same negative side effects and contraindications that you might get from the others. The tirzepatide, so this is the two hormones, the two peptides included in this one. It too, the tolerance varies significantly. I just cannot tell you if you're going to tolerate it or not, and it's very dose dependent. Again, almost everyone has to increase the dose. The weight loss seems to be a little bit better with tirzepatide than with the semaglutide. It does seem to have better glycemic control. The thing I like about it over the semaglutide is lean body mass retention seems to be a little bit better. Again, the weekly dosing, it's expensive, it's not covered by insurance, and there is a compounding option. And again, like I said, I'm going to breeze through these because they're all the same. They are just unfortunately side effect heavy. And again, that is very, very dose dependent. So one more time, we're going to go back to Ben. Let me stop sharing my screen and get back to him and get to the right period in his presentation. Let's see here. So 1507. Oops. We'll start there. Here we go. Oops, and I don't think I'm sharing my screen. Hold on a second. Let me do that. You don't want to watch me and listen to him. So let me get back to Ben on this one and make it bigger. And one more time. Here we go.
Targeted and made into a class of drugs. So there is a whole class of drugs called GLP-1 receptor agonists. In other words, drugs that act like the hormone GLP-1, I will add, albeit much more powerfully. You've heard of some of these. There's a difference between the name of the drug and then the brand name. So exenatide is a common drug nowadays, and it comes in the form of Byetta or Bydureon. Another one is liraglutide, which comes in the form of Victoza or Saxenda. And then the most famous of all is semaglutide, which is the main drug in Ozempic, Wegovy, and an oral version, although it's much less effective, Rybelsus. Now, some of you may be thinking, well, what about Mounjaro and others? Those are drugs that have a GLP-1 agonist like these, but also additional drugs in them as well. Now, what are some of the concerns that I, as a biomedical scientist, have? One is that sometimes it can slow the stomach down so much that it can paralyze the stomach, which is a very lethal problem. And I mean lethal, it can literally kill people. Second is the increasing evidence that it really damages lean mass, including muscle. This paper in particular found that in people on semaglutide, up to 40% of the weight that they were losing was coming from fat-free mass, or that's another way of saying lean mass, which of course includes things like muscle and bone. Now, part of why the people lose weight is because of what happens to cravings. So in the midst of you're not as hungry, or you crave less, or your muscle is losing, surely the benefit is somewhat still worth it because of the reduced cravings. And that is something that happens. One of the first things a person will report when they go on these drugs is they will say, the food noise is gone, or I just don't have the same cravings like I used to. Unfortunately, even that has, to invoke a concept of economics, some diminishing returns. This paper that was published not long ago was interesting in that it looked at people on these drugs and they had a survey to monitor their cravings. And so they wanted to know, how well are you able to control, or how tempted are you by sweet foods? And they followed them for 2 years. At about a half of year, so about 6 months in, and so let me just orient you on this figure. This at 0 is where people start. So 0 would be things are normal. That would be based on this survey, my cravings are right where, that's where I normally am. That's my baseline. And so at week 20, which is about a half a year in, look at how much down their sweet cravings are. So they had a significant reduction in their cravings for sweet foods. But look at what happened at 1 year. You can see that it's starting to creep back to that baseline. And in fact, the moment that error bar touches it, it's normal. And sure enough, at 2 years, they're right back to where they were. So even people who stayed on the drug with the full dose, they had a total return of sweet cravings at 2 years. That's pretty damning when it comes to these drugs, because that's the main benefit, is that it's controlling your cravings. Unfortunately, tragically, as people notice that the food noise is starting to come back, or that their cravings are coming back, they, of their own volition, may start to increase their dose or double dose. Unfortunately, this is really when the problem of paralyzing the intestines can become significant. And again, that is a very lethal problem. As another point that I don't have a specific note here, within the United States, and in the UK, it's very, very close to this, so it's probably a worldwide effect. About people have such nausea, or their stomach is so uncomfortable, that about 70% of patients who are on these drugs choose to get off the drug at 2 years. And of course, any of the weight they've lost comes right back, but not necessarily the muscle that they've lost. Now, with all these benefits of GLP-1, naturally, we want to take advantage of it. And so
Okay, gonna stop sharing that screen, and for the last time, go back to my PowerPoint here. Oops, that one. 2 more seconds and this will pop up. And here we are. So again, the application of GLP-1 boosting things or medications that are GLP-1 agonists really depends on the person. Again, really evaluate the severity of the metabolic burden that's going on, their success and failure with other things, their age, the risk versus benefit, and such. So really, this piece plays a huge role when I'm helping patients to try to decide what to do when it comes to these different medications or natural options. And so I do always point out the danger is in the dose and the duration of use. So the studies that we have available to us are only, and I say this strongly, only on patients who are on the maximum dose. We really don't have much data when it comes to those who are using smaller doses or microdosing it. And then a lot of the studies have looked at these patients who've been on it for quite some time. There's no studies out there on these lower doses. And so that's really quite unfortunate. There's a lot of people out there who do support microdosing on this. Dr. Tina Moore is a big one who's out there. And she even says in a lot of her stuff is that microdosing is much better. It reduces the side effects that are negative, and it will enhance better longer term success. Again, there's no clinical studies on this, so we can't make any guarantees when it comes to what is this going to do to somebody long term. But it is something that's an option for out there. It is always recommended to be done in conjunction with the diet. We call it almost like a training wheel, or a getting started point. We want you to, if you choose to go on these medications, use them as a starting point to control the cravings while you learn and practice incorporating a metabolically healthy diet and lifestyle. And so again, she says in all of her stuff, further research, the research is lacking and further research is required. So I did want to take a minute and talk about those DPP4 inhibitor medications. And so this is just a chart that I found that talks about all the different ones out there and the doses that you can go on to get them. It does slow or inhibit the degradation of GLP-1, like Bennett said. And so therefore, if you're on something like this, or the ferulic acid in the Unimate, it will keep the GLP-1 you have around a bit longer. You can combine it with something like metformin for somebody who's really metabolically sick. I never see this prescribed anymore. No one ever comes to me on one of these medications. I'd have prescribed it, of course, to people, but I only prescribe it in situations where they're going to do it in combination with something that is boosting their own GLP-1. If you're not making much GLP-1 to begin with, inhibiting breakdown of it isn't going to be impactful at all. But if you're doing something to help boost GLP-1, addition of these medications, anecdotally, I've seen about 80% of my patients adding this in can be very, very helpful. And the negative side effect profile on this is a lot less than those other medications. And so what is the takeaway from this presentation? First of all, there is no one size fits all. It is extremely important to work with somebody who knows what they're talking about and to understand what is your health picture, what does it look like, and how extreme do you need to go with the interventions that you decide to work on. You must understand the risk versus benefit profile. I had a patient the other day who, she needs to lose 100 pounds, but she has a history of pancreatitis. Well, we don't want to go on any of these medications because it will increase her risk of pancreatitis, and anybody who has been through pancreatitis definitely doesn't want to do it again. And so we really need to weigh in that risk versus benefit profile. I very much recommend to proceed in a stepwise fashion. I always start with the thing that has the least risk of harm and then move up as needed. And the last point is none of this should be demonized. There are a lot of people who benefit from these medications and who need them. But there's also a lot of people who take them for more vanity purposes, which I don't support. So where do I recommend to start? I recommend to start here. For me, this is the easy no-brainer when it comes to what can you do to boost your own GLP-1. The Feel Great system is amazing. It is zero side effect. People do really well with it. It tastes good. It will improve things like intermittent fasting. It improves insulin sensitivity. The fiber in the balance is both an insoluble and soluble fiber, which actually really enhances the microbiome in the gut. Again, augmenting the Unimate because that ferulic acid will be converted even better. And so this is a really, really simple place to start. The company's amazing. They offer a 90-day money-back guarantee. So if you try it for 90 days, you follow the diet, you follow the fasting protocol, and you don't have success, you get 100% of your money back. So there's no risk to this. If it's something that you're interested in, you can certainly look at this link, screenshot it, and go put it in. In order to have the 90-day money-back guarantee, you do have to use a direct link. And so make sure to use this one. You're very welcome to direct message me, and I can cut and paste it into a direct message if it's something that you're interested in. So, and again, another option, if you really want to deep dive into all of these options, please feel free to consult with me. You can find me either at Venn Integrative Medicine or Insulin IQ, and we can really deep dive into all the different things that are going on well and above just GLP-1. So that's my presentation for tonight. Let me get on here and see if anybody has any comments or questions when it comes to the things that we discussed. I gotta mute myself here. So I don't see any. So either I did this wrong and and you guys aren't seeing me, or we're gonna have to see this in, oh, there it is. I'm going, wait a second. How is it that there's none? Let's see here. Any questions? I see a lot of reposts. Thank you everybody for reposting. Jennifer, thanks for the comment on its helpful information. John Brassfield says, the protocol works for me. He's 91 pounds gone in 8 months. So just a good testimonial to the fact that the program and the protocol works. And most of us, I take it myself, most of us really enjoy it again because it tastes good, and it does help you feel better. Anyway, so I've had a long day. I actually participated in a podcast about an hour before this started, which was fantastic, but it was also a little bit zapping. It is called, oh, what is it called? If anybody wants to look at it, it's coming out next Wednesday. I'll have to, let me pull this up. It's not letting me pull up two PowerPoints at the same time. It is called the Life Possible podcast. So if you don't follow that one, go follow it. And my podcast with him on women's health and insulin resistance will be posting on Wednesday. So anyway, little plug for John and his podcast. Otherwise, everybody have a lovely evening. I hope this information was beneficial. And again, direct message me if you want information on how to get to the Feel Great.